What's going on, guys? Dr. Bailey here with Dr. Bailey's Evolved Health and Wellness. Getting started a little bit early. We'll give some folks to some time to get online. Um, Gonna have an interesting discussion today. Uh, the main topic initially is going to be weight loss and cannabis. Not an overly involved topic. It's pretty straightforward, and we're gonna hit on that. And then with just everything that's going on right now, I felt like it'd be a good time to kind of just openly discuss from a common sense perspective, um, politics and not what you think. Not really going in Democratic, Republican, anything like that. And I don't really want any, negative discourse over here. What I want to talk about is what's going to happen with cannabis, or at least what I think is going to happen with cannabis in the Oklahoma region, at least following the election, and then also some discussion on COVID and masks because there's a lot of back and forth right now. Everybody's seeing it, everybody's hearing about it, everybody's talking about it. I definitely want to encourage some discussion. So by all means, drop some comments or questions in here, and we'll be glad to discuss those. Just be civil. I know that today is going to be a kind of a hot topic, and trust me when I say that I'm very um, common sense approach with all this stuff, and I don't really get off into anything one way or another. But I just want to try to bring kind of both aisles together and kind of discuss some things. Appreciate it, Mr. Brooks. We did have a pretty good outing a week ago. Was able to win the Rage in the Cage featherweight title. Tough fight. We're gonna wait and see. Had some injuries from that fight that I've got to go get evaluated and looked at over the next couple of days. Hopefully we'll have some ideas on what's coming up. Even if I don't fight anymore, which we'll see. I don't know. I'm getting to be about 40, so it is kind of a deal there. But we'll definitely step off into some triathlons, marathons, ultra marathons. Keep everybody abreast of what we do and how we're doing it, how we're preparing for it. I'm a big believer in the cannabis realm as well as the general supplementation realm, and that's one of the things we're going to hit into in the COVID discussion here in a little bit about what how I believe in some certain things and what all needs to happen. Weight loss. That's a huge topic, and it goes into a bunch of different variables. And anybody, hey, Miss Blankenship, thank you, Miss Kerr. Um, Anybody that has followed me for very long know that I discuss weight loss with a lot of different issues, especially with pain, back pain predominantly. When we look at any 90% of the population, if you have back pain, and I'm speaking of someone, I personally rolled my truck almost 200 yards on the highway in 2017. I blew out 3 discs in my lower back. Did injections. I did the goal-directed physical therapy for 14 weeks. I mean, a bunch of different things. So speaking from personal experience with all this, but if you take the average individual, especially in the Midwest United States, and you have them stand up and point to where their pain is, it's typically in their lower back. And if you draw a line straight from your lower back, straight out the front of you, 90% of the time it comes out your belly button. And what we know, unless you have an injury, that even post injury, when you have a lot of distribution of weight in the front, what it does is it pulls on the curvature of the low back, which squashes your disc down, strains the muscles of the low back, and causes predominant worsening of your pain. So with cannabis, how can we affect that? We've post Oh, Mr. Brooks, yes, we're going to hit on that again here in just a minute. THCV, that's the endocannabinoid that definitely provides the most response when it comes to appetite suppression as well as metabolism increase. What we typically see is most of the sativa, not most, but a lot of sativa hybrids. Let's see here, Jack the Ripper, Durban Poison, the Girl Scout case is typically a 60-40 indica, but still anything that can provide significant levels of THCV is also caryophyllene, myrcene, humulene, all seem to provide a really strong response in helping decrease appetite and working towards weight loss. And one of the big discussions I have with cannabis patients routinely is, hey, what you'll notice is this. You will notice that you're going to sleep better. Your mood is going to be better. You're therefore going to want to be more active. So, what can we do with that? Well, we lose weight. That helps us be more active. Anybody that's heard me talk knows that I'm a big proponent in the keto diet or a variation of the keto diet. You do have to monitor your cholesterol and you have to educate yourself a little bit. And that's one of the reasons I'm always trying to be available so I can help with that, where you get your fat sources from, because it is higher in quality fats and higher in protein. If you've been following my journey, July 5th, I weighed 205 pounds, 4th, July 5th. And then when I weighed in for my fight, October 23rd, about a week and a half ago, I weighed in 144.0 pounds or 44.5 pounds, which is about a 60 pound weight loss in 14 weeks. I ate the whole time. I did have some calorie restriction. I'm not gonna lie. I was averaging, anywhere from 1,400 to 15 or 1,600 calories a day, and I exercised a lot. But I was able to do that gradual weight loss over time. Now, 145 pounds is not sustainable for me, so I had to slowly put that weight back on. And my healthy walk around weight's about 175. And it's something that can be done as long as it's done cautiously and correctly. Now, I also monitor my blood pressure with that. And the reason weight loss is so important, and again, from my own personal perspective, I try to always, come at it from an angle of myself. I check my blood pressure every single day. I sit down in the morning about 5 a.m. at the computer to start typing up my notes for the day, preparing for the day. I check my blood pressure. In July, my blood pressure was 158 over 92 on average. It was kind of about my average blood pressure readings. Right now, and all last week and week before, I mean, my blood pressure sits about 118 over 62 now. No medications. All it was weight loss, exercise, a lot of cardiovascular exercise. And a lot of folks will tell me, hey, listen, my knees are bad and my back's bad. I can't really exercise. That's not a problem. We can work around that. With that weight loss, instituting weight loss, instituting low impact. Running on roads is not my big thing. I've been doing it more and more, and I'm forcing myself to do it. But even at 40, it's starting to hurt my hips a little bit. Um, I'm kind of hard headed, which is why I still want to do an ultra marathon. I still want to, which is a 100-mile race. I still want to do some triathlons and stuff, but we can ease into it from different angles: biking, swimming. Now, one thing that a lot of women, especially older women, we see them all the time in aerobics classes and in the water. Water aerobics is a big deal, and I'm a big believer in it. You can do some phenomenal things, but one thing you have to be conscious of is too much low impact activity can actually worsen bone density. The reason is it's the impact on the ground that causes your brain to send out chemicals that causes you to absorb calcium into your bones and harden your bones. Same thing with young children. So again, with that weight loss journey, we want to try to cautiously and slowly implement things that cause some minor low impact, but not no impact. And sometimes as we age, we get up into the 70s, 80s, and 90s. Sometimes we can't avoid that because there's just too much inflammation done over time. But it is something that can really, really work. Now, let's see here. Let's see. There's a bunch of talking about. So Charles Brooks. Let's see here. He's got a lot of no back and forth, just wear masks. Okay, so here's my big discussion on masks and COVID-19. The big concern with masks and the big concern with COVID-19 is overrunning our healthcare system. And yes, in the fall, we typically do have a decrease in healthcare space because of influenza and other things. But, and this is something I propose to Charles or anyone else, and I'm a big believer. I wear masks, especially if I'm out in public and I can't stay 6 feet away from folks. When I go do my hospice visits, I'm gloved up, masked up, and sanitized up, all of that. But here's something you have to really think about. And this is something I'm going to really throw, and I will argue this with any medical provider in the United States. No one is talking about general health and wellness. And if, as a government, we're going to mandate masks, which, hey, I guess go ahead and do that. But here's the other thing: if you're going to mandate masks, they really need to outlaw cigarettes. They really need to outlaw soda pop. They need to outlaw the things that actually contribute to very significant health risks. Number one in Oklahoma is cigarette smoking. Number two, diabetes and obesity. Number three, cardiovascular disease. You want to talk about hospitalizations? It's those three things. So why are we not spending some time in discussion here on decreasing and cessation of tobacco use, decreasing and cessation of sugary drinks and diabetes and weight loss? Cardiovascular disease will follow with weight loss. Those things. So as that's where it's a slippery slope. And I'm all for it. Like I said, but do I think they should be optional? I learned this a long time ago. I walked in, and as a young doctor, I was all for trying to help patients in every way possible, even if I would have to like throw medications at them or hold their hand and walk them down the hall to get them up to maybe get them out of the hospital. But one thing I learned after kind of getting frustrated over and over and over and over, just or more let down than frustrated, is that we can't force folks to do what we want them to do. They have to want to do those things. And the same thing happens, with mask wearing and COVID and all these other issues. I'll give you a prime example. So it was 2000, I believe it was about 2017 before I deployed. I was working at one of the local heart institutes here in Tulsa. Had a patient life flighted in with severe cardiovascular blockages in his neck, almost 100% bilateral blockages. The guy was being flown in for emergency carotid endarterectomy or kind of rotor rooting of his carotid so that he didn't die. And so as soon as his helicopter landed, he went straight to the CT scanner. He was scanned, found out he had 100% blockage on one side and he had a 98% blockage on the other side, which meant he had a 2% opening there, which, as strange as that sounds, is enough to not have to have emergency surgery, but could have surgery the next day. So the ER calls me and says, "Hey, this guy's up here in the room, and we need to come see. Need you to come see him. His blood pressure's pretty high, and he's pretty worked up." I said, "Okay." So I come walking up to go see this individual, and I walk into his room. His family standing in right outside the door. He's sitting back in bed. And he has this bedside tray across his lap. This gentleman has had a triple bypass and has already had both carotids open once surgically. I walk in and he has a McDonald's double cheeseburger sitting on his plate. He has two large orders of French fries and two cans of Mountain Dew. And when I walked in and looked at him, I was kind of shocked. And at first I thought it was a joke. And I said, "Are you kidding me?" And this individual got so mad that he pretty much threw his food at me. And then his family tried to kick me out of the room, and it just became a big deal. And one of that really highlighted to me how folks feel, and we can't change that. So that's the thing with the mask again is this is a slippery slope you have to look at. And you have to understand that if you don't wear a mask, you get sick. There's a chance you're going to end up in the hospital, and there's a chance there's not going to be a hospital bed for you. A lot of folks kind of miss out on that point, and because it's not affected them closely. And now, the flip side of that is, hey, you know, you people are grown. People need to make their own choices, and you have the capability of protecting yourself, staying home, masking up, sanitizing, all those things. And there is no right or wrong answer. Yes, Charles, do I think that masks work? I think that they decrease your risk of transmission and exposure. Are they 100%? No, nothing's 100%, which is why I use them. But do I feel like we can force people to use them? I feel like that's wrong. And I feel like you really have to be cautious with that. Again, when you tell people that they have to do this, you again, you're just running a real slippery slope with when do you cross that line of what's too much, telling people you can't do this or you can't do that. It's no different than cigarette smoking. It's no different than drinking a Mountain Dew out of the soda, pop machine, those types of things. Like I said, I kind of sit on both sides of the fence. I see both sides of it. I actually did a video back in March, I believe, right after it came out, and I was pretty simple with it then. I said, "Listen, the death rate is not nowhere near what it had been proposed to be because the testing wasn't accurate and wasn't up to date. We had a lot of deaths that were misproportionately given towards COVID when there were some other issues going on. I think as a medical profession, we have sucked at being transparent with what's going on. I think we've said things and said, hey, this is what is going on. This is the rules. This is what we know. But we haven't opened up discussion to people and answered legitimate questions. A big talk I hear about is, hey, if masks work so good, you wear your mask. I don't have to wear mine. You're absolutely 100% correct. It does provide some protection, but the percentages of protection go up exponentially with mask wearing. I get it. I hate them. I went to Silver Dollar City with family, I don't know, a month and a half ago or something like that. And it's miserable walking around. We literally stayed for like 2.5, 3 hours and then came home. It was or went back to the hotel. It's just no fun, and I'm over it. From the work experience, I absolutely feel for all these people that can't pay their bills right now or don't have jobs and have had their whole livelihood pulled out from underneath them. But then again, I also feel for our healthcare workers that, believe it or not, the ICU beds are starting to fill up pretty quick. There's a lot to that. I think we're going to see more and more. Do I think COVID's going away anytime soon? No, I really don't. It's a common cold with a little bit more virility to it, and we're learning more and more about it. But what I suspect is going to happen about the time we start to get this one hammered out, there's going to be a mutation and cause more problems. Um, a vaccine's going to come. I know that I'm not a big new vaccine pusher. I get all my shots. I always had all my shots. The military kind of ensures that. And I'm sure the military is going to make sure that I get the COVID vaccine when it comes out. But otherwise, I probably wouldn't get it for a year and see how it played out and see what all was going on with it. There's a lot of people. I just returned last week from the Dominican Republic, and they have been devastated because they're a huge tourist area and location. They all of the employees and workers that came across there, they're praying for a vaccine because whether it works or not, they're all going to get it. Hope that it increases travel again. And hearing it from their side of view, they're super excited about it. I'm just thinking, man, I just don't know. I really don't. Um, I'm not trying to be the bearer of bad news, but I do think that it definitely has. You have to look at it from both sides, whether you're pro-mask or you're anti-mask. It goes a lot into the politic issue that we have right now. It's you're right, I'm wrong. Well, there's some right to both sides of this discussion, and it's a tough place to be. I'm not gonna lie. Let's see here, make sure. Uh, Let's see here. Miss Bachman asked if I use trash bags to cut weight. No, I do. There is a sauna suit that they produce. It's called By Cutting Weight. That's basically like a scuba diving suit. It's really thick neoprene. I use that towards the end of my weight cut, just was I'm boxing and running and doing my cardio, and it definitely works pretty well. Uh, oh yeah, Steve, we got to get you to quit smoking cigarettes, brother. Cigarettes is a big bad problem, y'all. And everybody is, man, I hear all the time when you hear people talk about they don't want to be on medications. That's the number one thing I hear about cannabis. Hey, I would rather try cannabis because I don't want to be on meds. But while they're sitting talking to me in their video conference, they're smoking a cigarette. And y'all, we can do so much better. And people talk about, hey, it's hard to quit smoking. Well, the number one thing that happens when you quit smoking is you get pissed off. And I tell this to patient after patient after patient. If you've got loved ones, if you've got little ones, you got family members, they would much rather have 2 to 3 weeks of a pissed off you than a dead you, or a nursing home you, or an on oxygen you, or an on hospice you. Um, that is the number one thing I can tell folks. Please quit smoking. It'll save you a ton. I bet you'd be amazed at the amount of money that you would save as well. And especially in a time like this when we're having some financial issues, definitely want to try to work on that. All right. So definitely we're having, and that's what I was hoping for. Good discussion, optional masks, other issues and big problems. And Mr. Brooks, you're absolutely correct. And it's definitely, again, guys, there's no easy way to this. There really isn't. And it's going to come down to, uh, as a population, how do we respond? And if we're in large groups, you got to try to mask up or maintain that distance a little bit. The risk factors are this: within 6 feet for more than 15 minutes of an actively exposed individual puts you at what we consider high risk. Outside of that, touching is a big thing. That's why the elbow bump, fist bump, that's kind of a big thing right now. Carrying around some hand sanitizer, keeping your hands clean. Otherwise, there's not a lot that you can do to prevent it. It's a cough, and it's most of the time it's aerosolized spread, touching spread. Another big thing some folks have not realized: if your hands are contaminated and you touch your eyes, touch your mouth, you can infect yourself pretty easily that way. And we've had several people get sick that way, so that's another thing to kind of keep caught up on. Mike Bell asked about what about the regular flu vaccine. There's a lot of back and forth on the flu vaccine. I get it every year. I have to for being a healthcare provider and for being in the military. I will say that I've had the flu a couple of years. Out of the past 4 years, I've had it two. One year they completely missed it with the flu vaccine, and I was sick. I was sick for about 4 days. It was the flu. It was no fun. Next year I got the vaccine and caught the flu. You could tell that they got it right that year, and with that I was sick for 12 to 18 hours maybe. And I mean I had the fever, had the shakes, had the flu or the chills and all that, nauseous, body aches. I laid up in bed for that afternoon, and thank God it was a Sunday, so I was able to kind of rest a little bit. Um, you can't get the flu from the flu vaccine. That is impossible. It's an activated virus that they give you. But you have to realize that flu vaccine is made off of an assumption. What happens is it travels from China and East Asia west, and so what it does is they sample blood from people all over Asia, Eastern Europe, and then it hits the CDC centers, and that's how they try to guess what virus is going to show up by the time it gets to the United States, is what mutation is going to be present. That's where the flu vaccine comes from, and I hear it all the time. I'll tell you right now, my wife does not get the flu vaccine, and no matter who I am, what I say, she's going to do what she wants, and that's fine. It's something that we're not around a whole lot of elderly or immunocompromised. She's probably the most immunocompromised person I know, and she does really well with it. So it is one of those things. But I can tell you that every year for the past several years, working in the ERs around Tulsa, we have seen I've managed patients, ICU level patients, sitting in ER hallways because of overload of our health system. And that's what the concern is with flu this year and COVID this year and those issues like that. Mr. Davis said that, let's see here, I've only had the flu shot in 20 years, only been sick once. That's phenomenal. That's great. And especially in rural communities, you can typically get away with that. You do catch it though. And as we age, that is unfortunately when it hits us the hardest. Uh, the flu, what gets a lot of folks is a concurrent bacterial pneumonia or infection that comes along with the flu when it runs you down really bad. That's where we typically see some big issues with influenza. Um, it's not again not a clear cut deal. Oh man, let's see here. Again, guys, share this video out. I see and read things all the time on all the various Facebook pages. My personal Facebook got deactivated by Facebook like 2 weeks ago. We have no idea why. I never really post on it. So I have my backup, the B Bailey DOs. I'm not in as many of the cannabis or just general groups as I was. I had that Facebook page for 15 years, I believe, and then they deactivated it. Said it violated Facebook standards. Not sure why or how, but I still read every day about what people are concerned about, their posts or their rants one way or another. And so that's why it was something I really felt strongly about addressing and trying to get some information out there. It's just what I consider common sense, straightforward information. Now, quickly on to politics, and I'm not going to touch Republican, Democrat, all that good stuff. No matter who wins, there will be a change to cannabis as we know legally, as far as scheduling, as far as just general legalities. And I get asked all the time, what's going to happen with that? Or when is Oklahoma going to get rec? Or those types of things. For one, I don't suspect that we're going to get a general legal program or recreational program in Oklahoma ever. And I say that because of the way our legislature honestly views our program as recreational already. Governor Stitt's come out and said that multiple times. Several senators and high-profile House of Rep members have said that. But what I think happens, and this just hear me out, there's a reason I believe this. I think what's going to happen is the government's going to deschedule cannabis or just generally legalize it. But what they're going to do is this number. They're going to say, okay, we're stepping out of it, but we're going to hand it over to the states to do how each individual state wishes. Why do I think that's going to happen? If you think about it, what drives all government decisions? Money. And if they take away the state's individual capabilities to tax, and look in Oklahoma, I mean, one of the big problems with cost right now is the dispensaries and the industry. They have to pay, it's like in the high 40% range of taxes on product sales. And it's been hundreds of millions of dollars of revenue to the state of Oklahoma from just the cannabis program itself. Uh, they're not going to want to take that away and open borders and do all those other things. They're going to allow the states, and I just strongly suspect that. Don't know. Haven't talked to anybody, just sitting back as an observer in the program and around the program. And I think that it's definitely something that could happen, and I see it happening that way again because if you follow the money trail. Steve, get scheduled two. I don't think you're wrong, Steve. I actually see it going to schedule two or maybe even three. Um, I don't know how they're going to respond. Again, I don't think it's going to matter if it's Biden and Harris or Trump. They're either one of them, or Trump or Pence. Either one of them, I think, are going to deschedule it. It's been all over the news. It's been the Senate's brought it to the floor several times. I believe there's something there now. I think it all gets tabled to obviously after the election. But I think that it's gonna happen. It's just there's too much progress being made, and it's the area of the highest level of research in medicine right now. And any medical professional that wants to argue with that, they've got their head buried in the sand and haven't kept up because there's some really cool. I mean, we know about CB1, CB2 receptors. There's a third one now that they're looking at very, very closely that may have more in common with the central nervous system. Which I mean, how cool is that going to be for dementia, for patients with paralysis or paraplegia following stroke or spinal cord injuries or something along those lines? I mean, that's a really big deal, and that's a big area and topic of research. Um, what else? What else? What else? Man, I think that was. Let's see. Absolutely, Mr. Davis. Says PTSD and other mental health issues. Yeah, I definitely recommend getting a license. I look at cannabis like this, and I say this repetitively all day, every day. Can we treat your symptoms and issues with cannabis and have it be safer than medications? The worst thing that's going to happen with cannabis, agreeing that you stay away from super high THC compounds that may give you some paranoia, is you're going to get a good night's sleep. You're going to eat dinner. Now on the topic of weight loss, depends. You use humulene or something with high THCV content, you're probably not going to eat as much dinner. Um, but it's definitely worthwhile, especially in the PTSD realm. And I actually did a video on PTSD a couple months ago, and I'll probably swing back to that. Um, and in the future and discuss it. I actually want to do a discussion maybe next week on veterans and cannabis. A lot of guys and gals are afraid to get their license because they're afraid to lose their benefits. I think I will discuss that next week on discussions about benefits. The firearm discussion is always a big one in treatment because there's some big things. We actually worked with several of the counselors here at the PTSD clinic. We've had some really good responses there. And we've been able to decrease a lot of medications, a lot of medications, and a lot of clinical presentations for suicidal ideation and whatnot. Um, Mike Bell. So our renewals in Oklahoma, they're 40. In Arkansas, they're 75 still. They will go down to Arkansas the next year. Arkansas, these are for the renewal cannabis licenses. Arkansas is really their medical board is way more peculiar about the information they want us to take down and know, and for your chart completeness. So they are a little bit more. What you do is you visit our website, you book an appointment, and then once you book your appointment, you sit down and have a Zoom meeting with myself. I started emailing them out a lot earlier. Earlier the links would time out. I've kind of got that fixed. So I'm sending out emails. Sometimes they go to spam folder, but you have to just monitor that, check your spam, search everything for Evolved. You'll get pulled into a waiting room, and then I'll pull you into the actual meeting when it's time or when if I have availability seeing you early. Today I saw a lot of folks early. And then afterwards, I email your recommendation form to you, set you up with application assistance, whether or not it's in Oklahoma or Arkansas, we can kind of get you set up. I'll walk you through the process and let you know what to expect. And then if you ever need anything, you just message the Evolve page. Again, I personally respond to all those. Even last week when I was on vacation, I still responded to everybody, usually pretty quickly when I got reception. Now, that was kind of hit or miss on some places not having the best receptions. I couldn't really do much with that. Let's see here. Miss Bowers, find better relief with Blue Dream and Miami Punch and one of sinus medications. It definitely can. And the reason being, so sinusitis comes from inflammation of the sinuses. They get clogged up, and then you get bacterial co-infection. Side note to that, antibiotics don't really help sinus infections. They've been proven to not provide much benefit. They may shorten your duration of symptoms by about 12 to 18 hours. maybe 24 hours. But at the end of the day, you're not going to get a lot of benefit from antibiotics. You might just get the risk of diarrhea or some of the other side effects antibiotics can cause. That's a big thing that we've done a bad job as doctors. We write medications for anything. You know, people come in, and I think it's because we want to make people feel like they're getting something for their business. John Hopkins on psychedelic mushrooms. I'll look into it. Psychedelics, Mike, are being researched heavily right now when it comes to PTSD, especially. There are a couple of, I think, even VA centers that are really starting to look into this. Colorado just had legalization. I haven't heard much on epilepsy, but it's something I can look into for sure. Again, we did a video on epilepsy, and some of these I'll try to revisit over time and try to be a little bit more thorough. There's been times that depending on what I was going on, I probably wasn't as in depth as I wanted to or should have been. And then again, I'm the king of ADD and ADHD, so I kind of bounce around a little bit. But those are great ideas, and it's something that I would like to try to work toward and see if I can help with if at all possible. All right, y'all. Any other big questions? All right. If you guys need anything at all, by all means, reach out. I'll be glad to get you guys taken care of. Again, I think next week we'll hit on to some of the veterans issues. So if you know any veterans, try to share it out with them. Share this video out. Definitely let some people know. Get in there and watch it. The more people that watch it, kind of gives me an idea of what they're interested in. Um, Again, last week or a week ago, we were victorious in our fight. We were able to raise $750 to donate towards Battle on the Home Front, Mr. Kyle Early's veteran group in Oklahoma City that's doing great things, helping veterans. They provide free vegetables and whatnot. Definitely a strong group of individuals over there that we are more than happy to help out. JKJ Processing came up big, helped us out with that. Green Country Bud on Yale here in Tulsa, that dispensary came on board as well and helped us out with that. I was able to get them on my shorts. Um, it's definitely been um, a big issue. Let's see here, real quick, Mr. Owens, arthritis. I actually did one on arthritis. Big thing with arthritis is your higher CB2 receptor, so indica dominant hybrids. Um, CBD, CBG. CBN is great for sleep, so you do have to be kind of a little bit cautious that they can be kind of relaxing. But it depends again if you're looking at flower or whatnot for that inflammation relief from arthritis. The topicals work exceptionally well. Be on the lookout for our website because we're getting ready to. We're having some meetings right now. My hope is to come up with a new product or a new to the market product in the next short while. And I will keep everyone posted on that. And I promise you, it's something that we won't bring to the market with Evolved name if it's not something that works and works well. So definitely something we'll be talking about in the near future. All right, guys, I've talked your ear off long enough. I'll let y'all go. If there's anything you're curious about, have any big questions, again, drop us a message on the Evolve page. I'll be glad to get y'all taken care of. I hope everybody has a fantastic week.